Hello, my name is Matthew Baez. Today I'm going to be talking about the coronavirus, or COVID-19, and the response by the United States government at both a federal and state level, and how the government responded to the pandemic and the results of that response. Now, I've applied the government response to three different pillars of public administration, those being accountability, efficacy, and legitimacy. These were the three pillars that I found to be most relevant in the government's response. Accountability, for the ability to hold the government responsible for the policy enacted. Efficacy, how efficient that response was. And legitimacy, uh, the ability for the government to act within its power and conduct actions which are necessary to meet its goals. Now, before talking about the pillars of public administration and their relevance to the COVID-19 pandemic, I would like to take the next two slides to speak about federalism and how it interacts with nationwide issues, and how the coronavirus pandemic showcased not only certain strengths, but certain important weaknesses of a federalist system. Now, under a federalist system, such as we have in the United States, certain powers are reserved for the state government, like the state of California, and other powers are reserved for the entirety of the United States as a whole. Now, this allows the separation of powers in government to ostensibly increase the efficacy of both policy. So, state policy is more concerned with the direct issues of its citizens and maintaining daily normalcy. They maintain roads, issue marriage licenses, levy certain taxes, organize law enforcement. And while the federal government does have a hand in some of these aspects, such as federal law enforcement, what the separation of powers here allows is it allows for the federal government, the larger government, to tackle issues which affect the entirety of the country, and the state to specify issues that only affect perhaps a certain locality or just the state as a whole. Because California does not have the same issues as Texas, does not have the same issues as Florida. This also reserves rights for the citizens, right? It ensures that federal policy is not so wide sweeping that it negatively affects citizens who live on a much smaller scale. State governments sequester those responsibilities to even smaller governments, such as cities and municipalities, which then directly interact with citizens, issuing business licenses, food handlers licenses, anything for a job. And what this allows is it means that citizens are most often interacting with the smallest form of government possible rather than the largest. That eliminates certain roadblocks, and it ensures that a large government is not directly impacting a citizen in their daily life. Now, the reason why this is a weakness is in terms of the COVID-19 pandemic is, and it ties into the issue of legitimacy, as we'll speak about in later slides, but the COVID-19 pandemic is worldwide, and most relevant for the United States, it is nationwide. In order to combat the spread of the disease, it really required all of the states to be working collaboratively. However, even though President Trump issued a national emergency, there was no national lockdown, because really there is no precedent for the federal government to have that much power. That was reserved for the states, and what that allowed was for the states who were most affected, and you'll see this with states with highly concentrated populations such as California, New York. They were most affected because as a disease, it spreads quicker in more densely populated areas. However, despite California being the first to lock down, there was still travel between other states, in and out of other states. And what this allowed was the coronavirus to spread, and states which did not have lockdowns, eventually every state had lockdowns or mandates requiring social distancing of some form. However, despite the weakness inherent in federalism, in that because states aren't always working collaboratively, it means that goals which require the collaboration between states in order to be successful, what it did allow was, again, as is the goal of federalism, it allowed for states to tailor their response to their citizens. So as California saw a decrease in infections and the negative effects of the lockdowns, which we'll speak about, these were primarily economic. However, there were some issues in terms of mental health, particularly with children. I speak about that in length in the attached paper. But this allowed for, even though New York was still having severe infection rates, California's rates had lowered. And this means that California was allowed to selectively open up certain aspects of the state and certain aspects of the economy. So I've spoken a bit about some of the benefits in giving the states their own power. But another benefit of the federal government, as opposed to having a complete sovereign nation of California, is that federalism allows the government as a whole to divide or to have access to a larger amount of funds and resources than an individual state could if it was its own government. Now, we've spoken about why having the entirety of the United States as one federal system would negatively impact the citizens, as well as entire localities, even a state as large as California, Texas, or Alaska. But another weakness of having a smaller federal government in terms of actual geographic location, not in terms of power, is that a larger federal government covering all 50 states allows for greater access to funds. We saw this when then President Trump issued a national emergency, and later when Congress passed the CARES Act. These allowed for a collective $2 trillion and $50 billion, not respectively, $50 billion after the national emergency was declared, and then $2 trillion from the CARES Act. Now, this money was taken from every single state's taxes. However, some states, particularly the more sparsely populated ones, weren't as affected by the coronavirus. There's less population and less population density. This means that the rate of infection is lower and the total number of people able to be infected is much lower. This meant that more money was going into heavily infected areas, such as California, such as New York. More money was going there than was going to Minnesota. And even though it levied taxes from Minnesota, Wyoming, Colorado, Texas, every state, it was selectively redistributed back to states with the most need. And the federal government, having a federalist system, allows for smaller governments to have access to larger amounts of funds and resources than they would have otherwise. Now, speaking about some of the pillars of public administration relevant to the COVID-19 pandemic, we're going to talk about efficacy. Now, it is unquestionable that lockdowns were necessary. However, as mentioned, lockdowns did not prevent infection from spreading across state borders, because lockdowns were done selectively by state. And this is, again, one of the weaknesses. If every state had a lockdown order, we would have seen a much easier path to recovery. However, or a much lower infection rate. However, because of the discrete orders done by different states, we actually saw a better path to recovery. Now, because of the severe economic effects of the lockdowns, we saw an increase of unemployment up to 15%, a number which hadn't been seen since the aftermath of the Great Depression. There were also 100,000 small business failures, and around 43% of small businesses were shut down, at least temporarily. Small businesses employ about 50% of the United States workforce, and there are about 30 million small businesses operating within the United States. And because of the economic effects, and despite the fact that the CARES Act and the issuing of a national emergency order allowed the government to redistribute money to citizens, businesses, hospitals, eventually that money proved inefficient because of the length of the infection. As you can see here, this is a chart of 2020, and although there are no dates on this chart, we are still in the midst of the pandemic, and states still have some measure of lockdown orders. And the economic effects are really still yet to be seen until far in the future, because this is the largest economic downturn seen since the Great Depression, surpassing that of the recession in 2008. This led to questions about the efficacy of lockdowns and whether or not other options would be more effective, or at least more attractive, and less and have a better balance between economic effects and the rate of infection. And as the prospect of a successful vaccine, immunizations through infection became more prevalent, as well as a lower rate of infection due to lockdowns, these measures would be pursued more safely. So we see the lifting of lockdowns. We go from no restaurants being open to outdoor dining being allowed while maintaining social distancing. Employees and patrons wearing masks. These are alternative measures which, while were also used during lockdowns, as lockdowns started to relax, these became more so the primary methods of combating infection. Legitimacy is the ability for the government to enact policies that are necessary. With a high degree of legitimacy, the government is allowed to have more free rein to enact policy that is necessary. It is also the perception that the government is acting within its legal limits. And due to the inherent inhibition of freedoms by lockdowns, the legitimacy of the government to enforce these lockdowns was questioned, especially considering the effects that it had on citizens and their families. In some cases, the unemployment or shutdown of businesses by small business owners was more detrimental than if they had actually been infected by the coronavirus, which has a low mortality rate, especially in young and healthy individuals. It has a low mortality rate and a fairly swift recovery rate. This is not speaking about other effects that persist beyond initial infection. This is also speaking about public perception, not necessarily my own personal opinions. I wanted to make that clear. But due to this, and due to the fact that individuals saw the economic effects of going out of business or losing their job for 6 to 8 months, possibly even longer as the lockdowns continued, the fear of infection became much less than the fear of the inability to support oneself, to pay rent, to pay for food, to pay other medical expenses. And because of this, the legitimacy of the government to inhibit freedoms, which governments are solely governments exist solely to protect freedoms. That is their primary goal. And the legitimacy of the government to actively inhibit the freedoms that it is created to protect, it meant that the government, both state and federal of the United States, took a severe hit in legitimacy and public perception. Both legitimacy and accountability are intrinsically tied to public perception. Legitimacy and accountability all come from public perception, legitimacy particularly. Accountability is slightly more objective. It is the ability to tie government officials and government agencies to the effects of their legislation. Government A implements policy A, and we know that. And the effects that policy A has, whatever they are, can be directly then tied back to the actions of government A. That's accountability in a nutshell. But because it is also tied to the actions of government officials, their actions afterwards are then held up to their words beforehand. And we have three individuals here. There were several others. However, I chose the three largest, or the three most noticeable public figures, because New York and California, I've mentioned them several times because they were particularly hard hit by the COVID-19 pandemic. And then this is Michael B. Hancock, mayor of Denver, and this is because of the publicity of his particular actions. We see Governor Cuomo. This is a particularly egregious incident wherein he hid about 50% of the deaths in nursing homes and elderly care homes from the federal government. And by his admission, this was for political reasons. Michael B. Hancock over here issued a statement before Thanksgiving, because Thanksgiving is a traditionally family holiday where people travel to go see family. He urged his constituents to stay home and accepted the fact that this would be difficult because the holiday season is sometimes the only time individuals and working adults would see their family members. And he promised solidarity with his constituents in that it is absolutely essential that they stay home, they not mix households, and that this Thanksgiving would essentially have to wait until next year. The very next day, he was seen boarding a plane from Mississippi for a family gathering. Governor Newsom over here of California, relevant to me as I live here, also had similar statements. He decried the mixing of households and social gatherings. He urged people to limit their social gatherings to less than 10, less than 6. This number would change throughout the pandemic as its severity increased and decreased. And also warned against mixing households and leaving your house for all but essential needs. Later that week, after those statements, he was found at a social outing with a number of individuals far in excess of the limits set by the state, all from different households. Now, because of this, because of the accountability, these three individuals were directly tied to their actions and then tied to their support of lockdowns. And this sort of government hypocrisy really caused a turn of public opinion against lockdowns, which were necessary. However, the actions of public officials and the accountability that they had led to an increase in public dissatisfaction with necessary actions.